doctor and the time of the doctor, we get both of them together. So firstly, thank you for sparing out time for us.
Well, my pleasure.
Sir, मेरे पास एक topic है. This is about arthritis. I am a little personally inclined also because I think I will take a lot of help from my mother as well. So सबसे पहले शुरुआत कर लेते हैं. अगर हम अपने audiences को बता सकें कि arthritis होता क्या है. What is arthritis, sir?
देखिए, आर्थराइटिस एक जॉइंट का कंडीशन है जिसमें जोड़ों में इन्फ्लेमेशन होके पेन हो जाता है. ठीक है, कई तरह के होते हैं. एक वियर एंड टियर से होता है, दूसरा सूजन से हो जाता है जिसको रूमेटॉइड आर्थराइटिस बोलते हैं. जो वियर एंड टियर से होता है उसको ऑस्टियोआर्थराइटिस बोलते हैं. कुछ और कंडीशंस भी होती हैं, जैसे इंजरी के बाद हो गया तो उसको पोस्ट ट्रॉमेटिक आर्थराइटिस बोलते हैं. या किसी को जैसे कोई गाउट है, यूरिक एसिड बढ़ा हुआ है, उन केसेस में गाउटी आर्थराइटिस होती है. और भी होते हैं, सोरियाटिक आर्थराइटिस होती है, क्रिस्टल आर्थराइटिस होती है, बहुत सारी चीजें होती हैं. पर एक चीज इसमें जरूर होती है कि ज्वाइंट की जो है कंडीशन डिटेरियोरेट हो जाती है और वो पेनफुल हो जाता है. So this is what I will say. In all of the arthritis, it becomes a painful situation.
डॉक्टर सुनील, जब भी नी पेन होती है, क्या द मेन रीजन इज, या क्या हम एकदम से कंक्लूजन पे पहुंच सकते हैं दैट इट इज ऑस्टियोआर्थराइटिस?
देखिए, हर केस में नी पेन का कॉज ऑस्टियोआर्थराइटिस नहीं है, बिकॉज नी इज मेड अप ऑफ बोन, ligament, meniscus, cartilage, and there is a soft tissue cover around it. So all the knee pains are not osteoarthritis. The diagnosis of osteoarthritis depend on clinical assessment and X-rays by a doctor. So the causes of the knee pain are so many, but one of them is osteoarthritis. Yes.
So if we have to identify the different types of knee pain on our own before coming to a doctor, is it there any window of possibility that I can make out on my behalf?
Oh yes. As a layman, you can do a lot to decipher what is it. Suppose you are in your late 60s, you get pain in your knee when you do physical activity, and there are some crackling sounds every time when you walk, and it gets worse on physical activity, then it's likely to be osteoarthritis. Yeah. Okay. But suppose you are a young man, you jump a lot, you run a lot, and you get some pain in the knee at the end of the activity, it's likely to be some kind of soft tissue problem, maybe a meniscus problem, maybe a ligament problem, maybe a cartilage problem. So younger people unlikely to have osteoarthritis. But if you are a person having arthritis, pain in the hands and feet and also in the knees, then it's likely to be some kind of rheumatological, can be the Gathiavan. So yes, as a layman, you can decipher a lot and you can have a fair idea.
डॉक्टर सुनील, मैं कैसे रिस्क फैक्टर्स को आइडेंटिफाई कर सकता हूँ, खासकर जो नी के ऑस्टियोआर्थराइटिस के हैं? क्या वो स्पेसिफिकली एज के ऊपर है, क्या ये जेनेटिक्स में भी होता है, क्या जेंडर स्पेसिफिक होता है?
देखिए, osteoarthritis is a very good question that you asked. Basically, to a large extent, this osteoarthritis is decided by genetics. So don't feel guilty if you get it. Yeah. But yes, there are other factors as well, which are called modifiable factors, which we can control to some extent. These are body weight. So body weight basically loads the joints, leads to wear and tear, and causes osteoarthritis. Then the other one is if you have an ongoing joint problem, suppose you have rheumatoid arthritis and you don't take proper medicine for it, then the end result of rheumatoid arthritis is osteoarthritis. The other one is suppose you have some injury, you have unstable knee, you have a torn ligament, you are carrying on with unstable knee. Gradually, there is more stress on the knee and it gets worn out. Again, it's osteoarthritis. Sometimes you have some kind of gout or these conditions, they can also lead to osteoarthritis. So these conditions, if you have a rheumatoid arthritis or you have body weight, these are modifiable factors. You can take medicine to control your rheumatoid. You can take medicine to control your uric acid and gouty arthritis. You need to work with your body weight. You need to keep your muscles strong. These are the factors which can help you avoid onset of osteoarthritis.
But sir, age or gender specific, is there a ratio that we have on record?
Well, there is not much difference between men and women. But if you ask me to point one, then women may be more prone because of their low exposure, because of some kind of osteoporosis and vitamin D deficiency. They tend to have some weak kind of muscles, and then that can lead to some osteoarthritis.
Right. If I may ask about the symptoms about the knee orthoarthritis, and How do you diagnose it?
Well, symptoms they vary from slight pain, maybe some on and off stiffness, maybe swelling, not able to bend the knee. So these are the initial symptoms. When it progresses, you might have some kind of bending in the knee. You might have a deformity. You might find it difficult to walk. It might lock. So it might be unstable at all that you can't put weight on it. So these are the symptoms as the osteoarthritis progresses.
Right. Dr. Sunil, now the main question, the treatment options. I think everyone looks forward to knowing what are the treatments that are possible in the medical field. So, what are the possible treatment options?
Well, it depends upon how much severe is the osteoarthritis. If it is the initial early osteoarthritis, in that case, all you need to do is work on your body weight, reduce the load. There will be less pain and less arthritis progression. Then you can do some exercises, make your muscles strong. It increases the knee balance and it distributes the weight around the whole joint. Again, you feel better. Still in trouble, then you can try some medicines. Mainly, it's a glucosamine, which increases the joint lubrication. So again, you get better and slow down the progression. If you're still in trouble, then you can proceed to the next level, which can be an injection into the knee joint to calm down the problems and the osteoarthritis. If it's still a problem and it's taking a toll on your lifestyle, then yes, you should see a surgeon and you might need some intervention.
Dr. Sunil, now my next question has two parts. One, when a knee replacement surgery is done, firstly, how is it done? If you can really brief us about that. And second, I've heard a lot that recovery is equally important after the surgery. So, how is the knee surgery done? And if you could highlight the possibilities of how to focus on the recovery.
Yeah, well, the first part of the question, how it is done, well, that's the surgeon's domain. But since you asked it, I will talk about it. Basically, we give a cut in front of your knee. We flip off your kneecap, we enter into the knee joint. We see the worn and torn surfaces of the knee. We remove these worn out surfaces, which are usually rough, irregular, and having some kind of ligamentous damage as well along with it. So we resurface the worn out surface and put a synthetic, specifically made surface for your size into the knee. So it's again a smooth surface and your knee becomes balanced again. And once we check the balance and smoothness of the knee, at the end of the operation, we stitch you back, we flip the kneecap back on it, and you start doing your rehabilitation. So this is how a brief about the knee replacement surgery. It is done nowadays with an advanced technique. It was 15 years ago, it was done manually by some particular instruments, but now it has started with the robots. So they have added a very high accuracy and precision, and that is leading to really better outcomes and quicker rehabilitation, good results. And at the minute, as knee surgeons, we are expecting the knee replacement to last for life. So that's the level of advancement in this surgery. The second question, that what exercises? Yes, they are very important after the surgery because you need to recondition your muscles to reactivate, to start working again. And you need to get your range of movement back again because of the pain. It might a little bit stiff initially. Usually these exercises are for 6 weeks. And in 6 weeks, your knee starts calming down and you start feeling the real benefit. And that recovery continues up to a year. At a year, a person can expect something like a 10-year younger than what he was at the time of the surgery. So that kind of bounce it can give to you.
मैं अगला क्वेश्चन और फाइनल क्वेश्चन ये पूछ रहा था सर. देयर आर लॉट ऑफ पीपल लाइक माय मदर, आई विल बी ऑनेस्ट, जो अभी भी डरते हैं कि जैसा है ठीक है, दो शी सफरिंग अ लॉट. तो हम उनको कई बार समझाने की कोशिश करते हैं दैट एनहांस ही होगा. सो जस्ट अ फाइनल क्वेश्चन, अगर आप हाईलाइट कर पाएं कि क्या बेनिफिट्स हैं डायरेक्ट टू समवन हु अंडरगोज अ नी सर्जरी.
Well, the knee surgery should be taken up by someone who is competent in doing it. That's one. Number two, A person should choose to have a knee replacement when the osteoarthritis is taking a toll on the lifestyle. If it is taking a toll on the lifestyle, then the results are really good. You enjoy it because it makes you independent. And independent means you need mobility, and mobility is life. So knee surgery is really successful. If you feel that you can't go where you want to go, you can't do what you want to do, you are not able to socialize, you are not enjoying your life because of the knee, in that case, if it is an advanced osteoarthritis, then yes, knee replacement surgery is a good option. It's durable, and post-retirement, it is expected to last for life.
Fantastic. Final question, Dr. Sunil. Is there an advice for anyone who's listening, watching, still not fully convinced in their mind? Just a parting message, just a message to sign off.
Well, what I mean is, if it is not creating a big trouble, then you don't need to do any surgery. Okay, so don't be an enthusiast about it. But yes, if it is troubling you, if it's not letting you enjoy your life, and it is your knee which is not letting you enjoy your life, and it's confirmed by an X-ray by the doctor on clinical assessment as well that it is osteoarthritis, then yes, the surgery is a successful surgery. It is effective, it is durable, and in a correctly selected patient, it lasts for life. This is what I will say.
Fantastic. These were golden words, sir. I think the first thing that don't be too enthusiastic about it, because everyone's doing it. So let's go for it. Golden words. Thank you so much, Dr. Sunil Kumar. Thank you for your time.
Well, pleasure. I see you again. Bye-bye.
Thank you, sir. Thank you.
शुभांशु, नमस्कार। आप आज मातृभूमि से,
नमस्कार,
भारत भूमि से सबसे दूर है, लेकिन भारतवासियों के दिलों के सबसे करीब है। आपके नाम में भी शुभ है और आपकी यात्रा नए युग का शुभ आरंभ भी है। इस समय बात हम दोनों कर रहे हैं, लेकिन मेरे साथ 140 करोड़ भारतवासियों की भावनाएं भी हैं। मेरी आवाज में सभी भारतीयों का उत्साह और उमंग शामिल है। अंतरिक्ष में भारत का परचम लहराने के लिए मैं आपको हार्दिक बधाई और शुभकामनाएं देता हूं। मैं ज्यादा समय नहीं ले रहा हूं, तो सबसे पहले तो ये बताइए, वहां सब कुशल मंगल है? आपकी तबीयत ठीक है?
जी प्रधानमंत्री जी, बहुत बहुत धन्यवाद आपकी विशेष का और 140 करोड़ मेरे देशवासियों की विशेष का। मैं यहाँ बिल्कुल ठीक हूँ, सुरक्षित हूँ। आप सबके आशीर्वाद और प्यार की वजह से बहुत अच्छा लग रहा है। बहुत नया एक्सपीरियंस है ये, और कहीं ना कहीं बहुत सारी चीजें ऐसी हो रही हैं जो दर्शाती हैं कि मैं और मेरे जैसे बहुत सारे लोग हमारे देश में और हमारा भारत किस दिशा में जा रहा है। 140 करोड़ देशवासियों से
इस ऊंचाई तक पहुंचने के लिए बहुत बहुत धन्यवाद देता हूं। भारत माता की जय।
धन्यवाद प्रधानमंत्री जी, धन्यवाद। और सारे 140 करोड़ देशवासियों को धन्यवाद, और स्पेस से सबके लिए भारत माता की जय।